Africa CDC is hosting a briefing on Africa's vaccine manufacturing for health security. Let's take you live there.
Big research groups as they are in other parts of the world. And that is really where we also need to start building. And that building needs a lot of work to be done by government, a lot of work to be done by our own private sector, so that we can begin to also link. And I think that's really one critical aspect about what the funders also need to consider. And this goes to various treasuries in a continent, is to consider research and development as an investment, because you all build the capacity to manufacture vaccines on that basis. You can't just call anybody from the street and say, let's come and manufacture vaccine. So we therefore need to start by putting more money in that. It will make it easier for our financing institution to then have those barriers at least lowered enough to be able for them to jump. And it doesn't help that where we've got pockets of excellence, those very pockets are also overstretched by even the developed countries who are tapping into them. I mean, we give an example here. We always hear that Africa has not been involved in the manufacturing of vaccines. But if you consider vaccine manufacturing as a long value chain, there have been so many clinical trials that have been conducted in the continent. And they have all been conducted on the back of investments made by governments in those countries. So that consideration is important. So if we then have our funding institutions appreciating that, yes, if we want to build capacity to manufacture, we are going to need to go deeper and perhaps take some of the risks that may not be the case in other parts of the world. So we need to really look at our own situation and its context and begin to say we need to do it so that 10 years from now we can actually be in a better off state. I mean, we've got countries that have done it, like India. They are now basically manufacturers of most of the vaccines and also drugs. So I think as an African continent, we need to start today to say, when we have the next pandemic, which could be very soon, we should actually be either ready or on the way to being ready. So our financing institutions should also be able to say, yes, we appreciate this is our context, we embrace it, and we want to build on it. Thank you so much.
Thank you. That was very helpful, and you're absolutely right. We cannot wait for the next pandemic. This is work that needs to begin now. And I take your point on de-risking and also research. Now, let me turn to Mohammed, Dr. Pate, my brother. So the two speakers have kind of alluded to this, but I'd like you to tell us a little bit more about some of the macro level and upstream ecosystem activities that you think would be required to enable vaccine manufacturing in the continent. And also, if you can say a little bit more about how do DFIs like yours, the World Bank, can also put in their sister organizations in order to make this a reality. Over to you.
Thank you, Omar, and thanks to the Africa Union leadership and the Africa CDC for convening this important conference on expanding Africa's vaccine manufacturing capacity. I know that yesterday's discussions, but also even the discussion paper that had been circulated ahead of this conference, had laid out adequately the issues, the challenges. So here I will focus my remarks on our perspective, as you've asked Omar, as the World Bank Group, on how development finance institutions can help solve the major upstream barriers, which have already been touched upon. And I will share also what the World Bank and IFC are already doing. A lot of work has been done over more than a decade, looking at the options for scaling up pharmaceutical and vaccine manufacturing in Africa. The World Bank and IFC have been involved at various levels, globally, regionally, but also in several countries. A more recent example is the Kilinto Industrial Park in Ethiopia, of which we are co-financing with various partners, some of whom are here, and progress has already been made in several dimensions. The progress, however, on manufacturing of pharmaceuticals and vaccines, as has been mentioned, is uneven across countries. And one potential solution would be to sort of think about regional manufacturing hubs and ensuring a common market to allow for the demand issue to be scaled up. I think Professor Orama hinted on that as a key issue in terms of demand certainty. For the vaccine manufacturing to really be successful in getting expanded to the level that we would like to see, important ingredients must be in place, and these are critical. Overall leadership and coordination of all key actors towards a common direction, as we are seeing now with the African Union, Africa CDC, with AfrExim, the African Development, and several other stakeholders and national governments, along with the multilateral financing institutions like ours, other regional development banks, bilateral organizations, private sectors, have to come together in order to bring this effort to fruition. And we must advocate for the political will to be sustained. Even though we are going through a COVID-19 pandemic, which has precipitated much of this discussion, this needs to be sustained and to mobilize the required resources, different types of resources, including things like fiscal policy measures that need to be adjusted. For example, the tariffs on imported raw materials to help producers of vaccines or even manufacturers of pharmaceuticals. Secondly, strengthening regulatory environment and harmonization within the continent. The World Bank has been supporting the African Medicine Regulatory Harmonization Initiative for more than 10 years with a regional approach that has been delivering joint dossier assessments, which then informs national decision-making on marketing authorization for pharmaceuticals. It has been applied to essential generic medicines in EAC in Southern Africa, ECOWAS, and several other parts of the continent, and is supported by the regulators all over the continent. And the African Union, NEPAD, of course, on behalf of AU is coordinating and ensuring the ownership of this effort. And we're happy to support that continental effort on regulatory harmonization. The bank also supported the work to help define the development of the African Medicines Agency, including contributing in terms of the business plan that was adopted by the AMRH Steering Committee. World Bank is ready to continue with this work. This is critical because the regulatory environment needs to be, in a way, strengthened not only in terms of the inter-country harmonization, but also the capacities of the national regulators, including their own technical capacity as well as the financial capacity, so that they can play the critical role to enable the actors actually operate at the level that will ensure successful development of vaccines and other critical inputs that are needed in that space. Then finally, the gap in specialized human capital and talent has been mentioned as a key area. The World Bank has been supporting the African Higher Education Centers of Excellence project since 2014. And the goal of that effort is to improve the quality, quantity, and the development impact of postgraduate education in selected countries throughout the region. For example, in the West African Center for Cell Biology at the University of Ghana, the Emerging Center for Science, Technology, Engineering, and Entrepreneurship in the Gambia, the African Centers of Excellence for Genomics of Infectious Diseases at Redeemers University in Nigeria, and several other centers of excellence. We need to do a lot more in that direction to build up the human capacity that will fuel the development of vaccines and the entire value chain, not only vaccines, but also other biologicals as well as pharmaceuticals. In addition, the vast trained African diaspora will be key to harness, and the World Bank is open to approaches that could enable the continent to harness its diaspora resources as well. Then improving access to finance for upstream business case development will be a key one. And I think Professor Orama alluded to what AfrExim and the exemplary leadership that it's doing together with AFC. And that is something that I believe that the bank and IFC can also support in terms of the business case development, identifying areas that need de-risking, and convening, working with other investors to finance projects. Here, I know that my colleagues in the IFC, part of the World Bank Group, can provide direct commercial financing to individual vaccine producers in developing countries who have agreements, let's say, in place with vaccine developers. And under such agreement, there may be requirements to supply either the local market or a basket of developing countries in the context of even the current pandemic, but beyond that, for other routine vaccines. These financing from IFC would be able to fund upfront capex, raw materials, and other working capital needs for production before they can reach a milestone for things like advanced market commitment payments. And a link to things like advanced market commitments, such as what you are seeing through COVAX, if organized through, let's say, the Africa Union Vaccine Acquisition Task Force, can mitigate the demand and price risk and will increase the creditworthiness and enable more conducive commercial financing, and will also eliminate the need for grant funding or even more advance payments to take the risk of the manufacturer. That is something that IFC is very much moving forward on. For private sector investments that are highly product dependent, IFC can also provide financing to the vaccine manufacturers with a backstop from grant providers on the risk of research and development. That is, if the vaccine that is in development fails, for instance, the risk is covered by grant funding. This is going to be purely grant funded, but that is something that I believe IFC will be willing to explore further. For investments that are more product agnostic, such as fill and finish, work on adjuvants, cold chain storage, IFC can provide and mobilize commercial funding for the private sector. And it can also consider a portfolio funding approach. So bringing in sets of companies from various countries, subject to ensuring that the quality standards and, are clear and that there are sort of predefined criteria for that. The IFC, in terms of financing for the private sector, has developed a global health platform within which, even within the context of COVID-19, has committed projects over $500 million in the health sector globally. These are in life sciences, medical devices, and services to help alleviate the impact of COVID-19. With a pipeline of over $1 billion, which includes almost $350 million in vaccine-related projects in the emerging markets. Some of the pipeline are actually potential projects on the continent. And the upstream effort is also an area that IFC is looking into, and we're doing that collectively within the bank, between the IBRD as well as the IFC colleagues. In summary, Omar, the World Bank Group, through both IBRD and IFC, is taking a very broad approach to enable enhancement of manufacturing capacity for vaccines and pharmaceuticals in Africa. And this conference is a great start. And we really want to thank the Africa Union and the Africa CDC and all the panelists here for this great initiative, and look forward to working with you all on the next steps. Thank you, and over to you.
Umar, Dr. Kaberuka is in the room, just for you to know.
That's what I wanted to, that's where I wanted to go. But let me thank Mohammed first for what he shared with us in terms of what the World Bank Group has done and is also prepared to do. And as we have time, I may come back to you just for you to think about one or two things that you could talk about in terms of what would it take now that you are prepared to do more than what you've done before. But let me take the opportunity to acknowledge the presence of Dr. Kaberuka. I'm glad that you've managed to sort out the technical issues that you may have been facing. Perhaps also to ask if there are any words that you'd like to share, but I know that we'll come back to you at the end to give you the final, the final word to close this session. Donald, anything you'd like to say at this moment? Otherwise, I can continue. You're on mute.
Thank you, Omar. Thank you, everyone. Apologies for coming in late, but I'm glad things are going very well. my appreciation to everyone in the room. I'm listening very carefully what is being said, and I would like at the end of this session to try to come in and bring it all together. So Omar, if you can continue, that'd be very fun with me. Thank you.
Excellent. I will do just that. And since we are at the midpoint, I will also take a pause to really again acknowledge the leadership of the African Union for providing us this just wonderful opportunity, because this has been part of the bigger conversation that we've been having when we think about the challenges associated with vaccine acquisition. And thank you, John, for making good on your promises to give us this opportunity. So now I'll turn to, I have so many brothers and sisters in this place. So another one, for those who probably don't know, is that Solomon and I spent 2 decades together at IFC. So let me turn to you, Solomon, and talk about collaboration. This is a space in which we have multiple stakeholders, such as DFIs, we have other donors here, technology partners, and other actors that were referred to by previous panel members, both in the private and the public sector. So could you just share some thoughts about the opportunities that you see in this whole space?
هل يمكن أن تشاركنا
any other room for collaboration that you might like to talk about, including blended finance and other wearable models that I know that you work on, so you cannot tell me that you don't know them. So that's the problem with you, is that I know what you've done. So please share that now with the bigger group.
Okay, no, thank you very much, Umar. And I would also like to recognize the Africa Union Commission under the leadership of His Excellency Musa Faki Mohammed, as well as John Inke Kazong, the Africa CDC head, for organizing this conference. Very timely. To understand the context of the need to tightly collaborate and to tightly coordinate, I think we need to just continue to appreciate the complexity of this particular manufacturing industry. And I know we've heard this over the past 2 days, but let me just try to recollect, a few of the key points that demonstrate and elaborate on this point. I mean, it's very clear that vaccine manufacturing is complex and requires huge financial investments, but also a long-term vision. What does that mean? I mean, India did not start on the vaccine manufacturing drive yesterday. We understand that it may even have been as far back as 40 years, okay? And it's gone through various steps of evolution. We also understand that the capacity to sustainably produce vaccines is multidimensional and requires a holistic approach to bring together financial, regulatory, and specialized human capital. In my opening remarks yesterday on behalf of President Adesina, I cautiously said that I believe we should be working on 2 vaccine platforms. Size of investments could be up to $400 million to be able to produce 300 million doses a year. People may think that's conservative, but I think vaccine manufacturing at the onset, because of its complexity, is not necessarily an entrepreneurial drive, but really is an institutional drive. And let me expand further. So we at the African Development Bank have industrialization really as a key part of our strategy for private sector development in Africa. And here we look at agricultural value chains to do value addition, to industrialize. We look at cotton to textiles to garments. We also look at gas beneficiation. In other words, in areas where Africa actually competitively produces the feedstock. Because to really focus on industrialization and to be competitive globally, especially in industries where economies of scale are important, you have to really have, the feedstock. Pharmaceutical, the APIs, vaccines, etc., the feedstock is not in Africa. So we have to keep this in mind, that it's not necessarily the value chain in which we could have been naturally competitive to begin with. So part of the question posed to me was, are there lessons from other manufacturing areas? When we look at cement, steel, food and beverage, mining beneficiation, there are upstream issues, there are midstream issues, there are downstream issues. And a lot of times, reliable and affordable cost of energy, as well as, better logistics, would make us competitive. And we can always take a look at, a single manufacturing project really as development institutions and finance it. But in the context of vaccine manufacturing, and remember, I'm not talking about pharmaceutical manufacturing. I mean, as I said yesterday, we had already prioritized before COVID pharmaceutical manufacturing as part of our industrialization strategy, not because the feedstocks are automatically competitive in Africa, whether we're looking at PPEs, whether we're looking at various therapeutics, generics, etc., but because of the need for a minimum security of supply. But this has been reinforced strongly as a result of COVID. So yesterday, I spent a lot of time actually listening to Mr. Nicolau of Aspen, and also Dr. Makona of Biovac, because these are examples of, two institutions that are doing pharmaceutical vaccine manufacturing.
All right, so we come out of the Africa CDC meeting looking at the manufacture of drugs.